Hello friends, in this video I am going to teach you about the attachments of the scapula bone. So let's start. First, this is the costal surface and this is the dorsal surface. First, start with subscapularis muscle. The subscapularis muscles arises from the medial 2/3 of the subscapular fossa. This is the subscapular fossa, and subscapularis muscles arises from the medial 2/3 of the subscapularis fossa. After that, the supraspinatus and the infraspinatus. This is the supraspinatus fossa in the dorsal surface, and this is the infraspinatus fossa in the dorsal surface. So, from the supraspinatus fossa, the supraspinatus muscles arises from the medial 2/3 of the supraspinatus fossa, including the upper surface of the spine. This is the spinous process and including the upper surface of the spine. And infraspinatus arises from the medial 2/3 of the infraspinous fossa, including the lower surface of the spine. This is the lower surface of the spine, with including this. After that, deltoid muscle. So, the deltoid muscle arises from the lower border of the crest of the spine. This is the crest of the spine, and from the lateral border of the acromion. This is acromion process from the lateral border of the acromion. So, after that, trapezius. Trapezius is inserted into the upper border of the crest of the spine. This is the spinous process. Upper border of the crest of the spine and into the medial border of the acromion. This is the medial border of the acromion. So, after that, serratus anterior. So, serratus anterior is inserted along the medial border of the costal surface. This is costal surface, and this muscle is inserted along the medial border of the costal surface. So, this is first digitation of the serratus anterior. This is second and third digitation. Second to third digitation from here to here, from here to here, and this is 4th to 8th digitation of serratus anterior muscle. After that, long head of the biceps brachii. Long head of biceps brachii arises from the supraglenoid tubercle, and the short head from the lateral part of the tip of the coracoid process. Supraglenoid tubercle is where from supraglenoid tubercle is present at the above of the supraglenoid glenoid cavity, not supraglenoid, only glenoid cavity. So this here is the origin of the short head of biceps brachii, and coracobrachialis also. Coracobrachialis arises from the medial part of the tip of the coracoid process. This arises from the medial part, and this arises from the lateral part of the coracoid process. And after that, I am moving towards pectoralis major. You can see here is the, it's pectoralis minor. You can see here is the pectoralis minor. This is the pectoralis minor, and pectoralis minor inserted into the medial border and superior surface of the coracoid process. After that, long head of the triceps brachii. This is the long head of triceps brachii. We can see these muscles on the both surfaces, here in the costal surface and here in the dorsal surface. The long head of the triceps brachii arises from the infraglenoid tubercle. This is the infraglenoid tubercle just below the glenoid cavity. And after that, teres minor. This is teres minor. We can see this in the dorsal aspect. It arises from the upper 2/3 of the rough strip on the dorsal surface of the lateral border. This is the lateral border, and this is the teres minor muscle. And teres major arises from the lower 1/3 of the rough strip on the dorsal surface of the lateral border. So this is lower 1/3 and this is upper 2/3 of the lateral border. After that, levator scapulae. This is the levator scapulae. This muscle is inserted along the dorsal aspect. This is the dorsal aspect of the medial border. This is medial border from the superior angle up to the root of the spine. This is the superior angle up to the root of the spine. After that, rhomboid minor. You can see rhomboid minor. Here is the rhomboid minor. Rhomboid minor is inserted into the medial border. Rhomboid minor is inserted into the medial border of the dorsal aspect opposite to the root of the spine. Opposite to the root of the spine, this is rhomboid minor, and after that the rhomboid major is inserted into the, this is rhomboid minor and this is rhomboid major, and rhomboid major is inserted into the medial border of the dorsal aspect between the root of the spine and the inferior angle. This is the inferior angle, so the rhomboid major is inserted here. After that, the inferior belly of the omohyoid muscles. So there is total 16 muscle. Here is the omohyoid muscle. You can see this is very. Here is the omohyoid muscle, and the omohyoid muscle. Here is the inferior belly of the omohyoid muscle arises from the upper border. This is the upper border or superior border near the suprascapular notch. This is the suprascapular notch, and here is the upper border near the suprascapular notch, and here omohyoid muscle is arises. So there is total 16 muscle arises. Some is arises and some is inserted into the scapula. After that, there is glenoid labrum, which is present in the glenoid cavity. And there is a capsule of the AC joint. AC joint is the acromioclavicular joint. After that, the coracoacromial ligament. The coracoacromial ligament is attached to the lateral border of the coracoid process and to the medial side of the tip of the acromion process. After that, there is, you can see, there is 1, 2, 3, 4, 5 ligament. There is first is coracoacromial, then coracohumeral, then coracoclavicular, then transverse ligament, and the spinoglenoid ligament. Coracohumeral ligament is attached to the root of the coracoid process. The coracoclavicular ligament is attached to the coracoid process, and the transverse ligament breezes across the suprascapular notch and converts it into a foramen. This is the suprascapular notch. And the spinoglenoid ligament may bridge the spinoglenoid notch. Spinoglenoid notch is not visible in this diagram. So the notch is formed so that vessels and arteries can pass deep to it. So thanks for watching this video, and watch my video, like, share and subscribe my channel, and comments please. Thank you for watching.